Sealand, Holland, Hudsonville, Grand Rapids. Here's Cynthia Palmer and Jean Parker.
Take it easy, take it easy. Don't let the sound of your own wheels drive you crazy.
First Light here, Parker and Palmer. Every 3 years, the Ottawa County community comes together to create its next version of the Community Health Improvement Plan, or CHIP. Now, this plan works to help us improve the health and well-being of local residents. Christina Wiesmink is the Communications Specialist and a Public Information Officer for the Ottawa County Department of Public Health, and she is in this morning to talk about that CHIP, or Community Health Improvement Plan. Christina, nice to have you here. You've got lots of information for us this morning.
Yes. Thank you for having me. Always a pleasure. We have the Community Health Improvement Plan, which is a huge endeavor put together by Ottawa County community.
Christina, as you unpack it, what do you find would be the key element or the most important thing that we should start working on?
Well, what we found out, and this is based on research from the Ottawa County Community Health Needs Assessment, which was done last year, along with other primary and secondary data, and we obviously realize that all these public health challenges are just far too great for any person or organization or sector to solve alone. So we brought community members, people from different health and service organizations, hospitals, businesses, schools. We all came together, looked at the data, looked at the plan from 2015, and saw again that the three top priorities are access to care, mental health, and healthy behaviors.
So when you develop this Community Health Improvement Plan and you look at it, do you develop strategies to improve those areas that we need to improve in?
Yes, we do. It's one thing just to say, hey, these are our problems, and another thing to actually make changes. So what we did is there were the three groups, and participants came together, looked at the different goals and objectives, and then recommended strategies. And that was developed by looking at what we have already in our community as resources, where we can improve or put funding, and what we can also add.
Can we take a step back? Christina, you said you accessed the 2015 report. Can you tell us how we did or how we're doing 3 years after that report came out?
Yes, we've had a lot of progress. There's still a lot of work to do. We've had several different programs that were a result of the 2015 CHIP. One is the Ottawa Pathways to Better Health program, and that is a program that's designed to assist people with accessing community services to really look at improving their health outcomes and decrease those unnecessary hospitalizations and emergency department visits, because we obviously realize that it's not just health care that influences someone's health outcomes, but it's all those socioeconomical factors such as education, employment, housing. So that program, the Ottawa Pathways to Better Health program, has community health workers that work with individuals to help meet all those needs. Other initiatives, which, again, there have been several since 2015, and they're still working and improving and becoming more and more prevalent in Ottawa County. And for the mental health initiative, we looked at the Be Nice campaign, and we helped expand that throughout Ottawa County. And there's also mental health treatment resources that we made available, just to kind of look at where people can get treatment and reach out for those resources. And along with mental health, there was also the first ever mental health millage that passed in Ottawa County. So that was extremely significant.
Yeah, that was a big thing here in the county. That was nice to see that go through as state funding becomes lower and lower, which is unfortunate.
Yes, you can definitely see how our community works together and looks at those important issues and puts time and money and effort into making things better. Another huge effort was Ottawa Food, and that is a collaboration of 40 or more agencies and individuals throughout Ottawa County. And what that collaboration does is it works to ensure that all residents have access to healthy, local, and affordable food choices. So part of the 2015 CHIP was to support their efforts and developing different programs that help people meet those needs and get healthy, affordable food.
Christina, it looks like we still need some hope in the opioid-involved overdoses that we have in this area. What are some of the plans you guys have for that for the future?
Well, there's been a lot of things that we've been working with organizations that work with substance abuse prevention, also mental health awareness and suicide prevention. And there's different ways that people can dispose of medications, different policies and guidelines that physicians are following as far as, dosage amount, and just a lot of it is just educating people and letting them know the adverse effects of opioid-involved overdoses or the issues that come with addiction.
We're having a lot of conversations these days about suicide. Even here in Ottawa County, what are you doing to tackle that huge problem?
We have a lot of organizations that are coming together to promote or bring awareness about suicide prevention and ideation. Because we are seeing an issue as far as the those who are seriously thought about ending their lives. We're seeing a big increase in teens attempting suicide compared to adults, and that's 40% of teens compared to 20% of adults who seriously thought about ending their life. So we're finding it more and more that it's younger people that are thinking about it, and it's really reaching out to those people who have contact with young individuals, whether it's through schools or, faith-based organizations and parents, and just really giving them the support that they need.
So when you look at the profile of those teens, is there any correlation between opioid or any kind of drugs addiction and drug use and the suicide ideology?
Well, I'd have to look at the data. I don't have that in front of me right now, but there are a lot of different factors that it's not just the drug-induced or drug-involved suicides, but there's other methods, and we just want to make sure that people are aware of, helping others prevent those ideations and attempts.
Every 3 years, Ottawa County comes out with the CHIP, the Community Health Improvement Plan, and they have got it out for 2018 as we chat with Christina Wiesmink from the Ottawa County Department of Public Health. Christina, I will call this the Ottawa Way. How this is all done and all put together, you investigate, you figure out strategies, and then you find partners and bring everybody together, and you get work done. I think it's amazing how Ottawa County works together so well.
It is. We truly have a fantastic community. Like I said, a lot of progress has been made. There's always ways to improve, but we're very, very fortunate to have so many different people in our community and organizations who help make that all happen.
Having said that, what's the biggest problem area do you think in solving some of our health challenges?
Well, I think a lot of that is just reaching out to the underserved population, just helping people realize or see that we do have resources available and connecting people to those resources. Because, again, like I mentioned, we have so many people helping and having those resources available, but it's making sure that people are getting connected to those.
So is there one website that people can go to that are underserved that can find some of these areas of need or help?
Well, we can start off by looking at the context of the CHIP because we do have different resources available there. So if someone's looking for any more information, we can both put you in touch with the right person. If you want to email chip@miottawa.org, or if you want to look at the report or the plan to see where different agencies are taking action, you can also get that online at miottawa.org/2018 CHIP.
Besides our discussion, Christina, and perhaps articles in the newspaper, how else do you plan to roll out this information to people?
Well, we're looking at having consistent update meetings and making sure that the work groups are continually communicating through the next 3 years, checking on the progress, and just helping to support each other.
I think it's great that you do this every 3 years. A lot of communities tackle this issue once in a lifetime.
Yes, again, we're very fortunate, and a lot of people just made pull the research because it is mandatory by hospitals and local governments that we do need to do community health needs assessments. But what we're really unique and fortunate in our county is that we take that information and use the data to make changes.
We're certainly glad you do. Christina Wiesmich, have yourself a great West Michigan weekend.
Thank you.